The way that I approach patients is as individuals. I think that every person comes to us with an issue that has their own background to it, and I feel that every patient should be educated on what's available and then have an option to choose what they think is best for them. So I typically try to educate my patients about what is out there and different approaches to their problem and let them make a decision, because I think that everyone needs to own their own health care. I think that's what makes me stand out in this department. I actually have a subspecialty degree in infectious diseases, and I work specifically with women who have HIV and take care of them from adolescence to death, and also work particularly with our HIV positive women who are pregnant. I have a subspecialty interest in sexually transmitted infections and vaginal vulvar diseases. I'm starting up a new vulvar disease clinic. Hopefully that will become something that is very useful to the Low Country. And I also have a strong interest in anal cancer screening in women with HIV, so I'm very interested in preventing the development of anal dysplasia and cancer in women. I also have a special interest in sexual dysfunction, sexual assault recovery, and global health. I've spent some time in India and Africa and plan to continue with my work there as well as here, and also expose our doctors in training to global health. I think that MUSC is a special environment and that we have specialists in almost every niche available. I think particularly women's health is a very special department because we have a lot of experts in the field in varying niches within OB/GYN, such as reproductive infectious disease, maternal fetal medicine, particularly preeclampsia, preterm birth, and multiple birth. We also offer subspecialists in gynecologic oncology, so people who take care of women with cancer. We have reproductive endocrinology, and we also have urogynecology, so we really cover the breadth of OB/GYN. And we actually have a family planning specialist and adolescent medicine specialist. So I think that our department has quite a bit to offer to the community, and for patients who are seeking specialty care or just to be taken care of by someone who's up to date on current practices, that they would be well taken care of at MUSC. Well, I am originally from South Carolina, and I attended the University of South Carolina Honors College and studied marine science and biology. I initially thought I was going to be a PhD and do animal behavior, and I became more interested in women's health. I came here to MUSC and obtained a degree in medicine. I knew from the very beginning I wanted to be an OB/GYN, and then I sought out residency in a different geographic location. I ended up going to the University of Hawaii and lived in Honolulu for 4 years, and then I returned to MUSC to specialize in infectious diseases in women and completed a master's in clinical research. And so I've remained at MUSC and plan to stay in South Carolina. It's my home, and I want to serve the people of the state. I think personally what I've done to change what's possible for women in this community is open up clinics for women specifically with HIV and sexually transmitted infections to help them to seek specialty care within the umbrella of women's health and feel welcomed and not isolated in our community. I think that our department has quite a lot going on to change what's possible for women. We have a very strong research background in our department. We have quite a few clinical experts, and we have a large group of caring people who are there to provide the best care for women anywhere from their adolescence to their elder years. So I think that we're the best option.